We can now speak to Amyesh Adalja. He is a senior scholar at Johns Hopkins University Center for Health Security. Can I ask you about these measures being taken by the Chinese government? First of all, how effective are they likely to be in stopping contagion of this disease, or at least slowing its spread?
It's unlikely that what's going on in Wuhan right now, with the very severe lockdown, with basically a military quarantine holding people in place, is going to do much but actually make things worse, because what they're going to do is deprive that outbreak zone of precious resources. There's already shortages there. They're going to isolate those people. It's going to make them much more distrustful of public health authorities. So I don't know that those measures that are being done now in this involuntary basis with kind of draconian enforcement is going to make things better, because travel restrictions usually do not work for any type of outbreak when they're imposed in this manner.
Tell me more about how it's going to make things worse.
So when you isolate a city or a country or a region with an outbreak, what ends up happening is not only can't people go out, you can't get resources in. And that makes it very difficult. We're already hearing reports of hospitals being inundated with patients, that their doctors are overworked, that there are shortages of doctors, that there are shortages of testing kits, shortages of masks. All of that will get worse if you isolate a place. And what it will do is make more panic in that area. And that's going to allow that virus to spread more easily when people are panicked, when people are trying to escape from the quarantine zone, and when people are distrustful of public health authorities and any messaging. So you have to be very careful when you use those types of restrictions so that you don't make things worse. And this virus is spreading, and it's going to continue to spread. I think that these measures that are going on in the outbreaks probably will not make much of a difference. What would really matter is getting resources in there, identifying cases, and treating those cases.
There have been reports of a hospital, a 1,000-bed hospital, I think, being quickly constructed to deal with patients of the outbreak, because hospitals have been overwhelmed in the country. What can you tell us about China's capacity to handle something like this?
Well, we know that China can build hospitals very quickly. They did this in the midst of SARS as well. This is a big city in the outbreak zone with multiple different hospitals. And China is very different in 2003 than they were in 2020. So they are able to take a lot more than they could in SARS and handle this a lot better. However, I think it's really important to know that we want to make sure that we're identifying all the cases and that those cases are being linked to treatment. Some of those cases may be very mild. They may not even need to be admitted to the hospital. So there's a lot of open questions about how they're going to deal with the number of patients that have mild illness, and if those mild illness patients are going to be forcibly hospitalized.
Is it becoming more dangerous the further it spreads and the more it mutates?
Well, all viruses mutate, and there's no evidence that this is mutating to make it some more nefarious type of virus. What I think the danger is going to happen is, as more cases occur, there are going to be much more panic. There's going to be much more concern, and that can cause people to make bad decisions. I think it's really important that we answer these unanswered questions yet about this outbreak. We still don't have a full understanding of how transmission is occurring. We know it's happening from person to person, but we haven't seen sustained human-to-human transmission outside of family clusters and outside of healthcare settings. So it's really interesting a phenomenon here that we've got this widespread, but we don't quite understand the epidemiology yet. We don't even really have a handle on the incubation period. So there's many basic questions that need to be answered. And I think as those get answered, this becomes an easier problem to solve. But there's a lot of science and medicine that needs to be done, and we need to be able to do that in the outbreak zone in order to actually bring this under control.
Yeah, there is a great deal of information we don't have about the severity of the disease. But for now, thank you very much, Amyesh Adalja, joining us there with your perspective. Thanks for your thoughts.